立刻就将病人从120的转运船上，带着我们的呼吸机，由他车上的呼吸机过渡到我们的呼吸机和氧气瓶，那么以快而稳的速度，那么送到我们的病房。
速度还是很低，不能维持，现在60-70左右。所以现在呢，我们要跟他做成 ECMO 治疗，就是大致说的人工肺，这样去抢救他。
先拍一下我手的样子，感觉特别轻松，把所有的负担都给扔掉了一样。
就是疲惫了。
就这样。
好早了。
差不多有14天了吧。我每天印象都很深刻，在这里的。
我们这么多危重病人，现在已经有7个人已经转到普通病房去了，也看到很多的好转的情况，所以有新的，就是说希望也在眼前，就是。
好像我们从一上班开始，我是指我当学生的时候，我们老师就是这样子的，不会轻易去放弃的，有希望一定要坚持的。
And while we deal with the growing emergency here at home, for many, the crisis is already in full swing. The most active hotspot right now is Italy. Nearly 200 people there have died in just the last 24 hours. Airports have been empty for several days, and now all stores except for pharmacies and food markets will be closed. Take a look at this. St. Peter's Square at the Vatican empty as the country with the highest death rate grapples with getting the spread under control. All this as a doctor on the front lines is issuing an alarming warning for his counterparts in America. ABC's Maggie Rulli is tracking the latest from London, where a health official there has announced they have COVID-19.
Life in Italy has officially crawled to a halt. People are finally taking the country's lockdown seriously. It took a televised plea from Prime Minister Conte to protect Italy's older population.
Un'Italia zona protetta.
The country hit with an alarming rate of infection that's been difficult to contain. More than 2,300 new cases of COVID-19 in just the past 24 hours, bringing the number infected to more than 12,000 and claiming the lives of 827. Its healthcare system strained so badly, medical professionals fear resources may run out.
We need to shut down everything. Here it was like a bomb. It exploded and all of a sudden you are overwhelmed by the patient.
Italy's government's heeding the calls. Everything but food markets and pharmacies are shutting down. Signs of a strained economy are palatable. ABC's Megan Williams is in Rome, where businesses were struggling to survive even before the total lockdown.
Just standing at my local pizzeria. Sandro, who's the pizzaiolo, the guy who makes the pizza, says that he has one more day probably to go like this. He's only had one client and then he's going to close, that it's just not sustainable to keep his business open.
Food shopping is the last sense of normalcy people have here.
People are not hoarding the way they are in North America. People have smaller homes. They also have different habits. They go shopping every day, and for now, people are keeping those habits.
But fear is almost as contagious as the virus itself. The World Health Organization declaring COVID-19 a pandemic.
It will be a tsunami. It will be eating all the country unless you take immediate actions. Otherwise, it will be too little and too late.
Nations with infections scrambling to test, treat, quarantine. In the UK, store shelves left empty as shoppers race for the last rolls of toilet paper and pasta. Nearly everyone we've met coming in and out of the supermarket says they are here to stock up on supplies. One woman says 48 hours ago, she didn't really think about it. Now, with all of this new news coming out, the new numbers, she is worried. She has 4 little kids she's worried about. Another man says he has a 3-year-old at home. He wants to make sure she stays safe. He's been to 4 other supermarkets, 0 toilet paper. And even though Europe's open borders are tightening, it may be too late to keep the rate of infection low everywhere else. UK's health minister announced last night she too was infected with the virus, tweeting, "More worried about my 84-year-old mum who is staying with me and began with the cough today. She's being tested tomorrow." China's lockdown measures seem to have worked. Infections there are dropping, but only after a month of keeping millions under strict quarantine. But Italy and other countries don't have the luxury of time to save their aging populations.
And Maggie Rulli joins us now. Maggie, the situation for many on the ground in Italy is just gut-wrenching. The healthcare system there is just extremely strained.
Lindsay, gut-wrenching is a perfect way to describe it. The reports we are hearing on the ground, they're almost hard to believe at this point. It really is being described as an entire healthcare system that is on the very brink of collapse. You know, many doctors there are saying they now are having to approach patients almost like wartime triage. They're having to make very difficult life or death decisions. We know they're very low on ventilators right now. The government is already talking about that triage situation, having to prioritize how they are going to save the most number of people, and it's looking like they may have to prioritize young, healthy people, which, Lindsay, we know that could mean that could be to the detriment of people that have pre-existing conditions. I mean, there's even talk now of putting an age limit on who gets ventilators at some of these hard-hit hospitals, potentially an age limit of as young as 60 years old. I mean, that's like people's parents, people's grandparents. I mean, these are emotional times, not only for people in Italy, but for the doctors and nurses that are on the front lines, having to make these difficult decisions. Again, describing it as almost like a wartime in some of these hospitals. Lindsay, it's just hard to believe.
All right, and Maggie, we heard from that doctor, and you've also traveled to some of those hot zones in Asia yourself. Should Italy be a warning to the U.S.?
Lindsay, this is really the big takeaway right now. Many infectious disease experts are saying that places like the UK, like the US, they're just 2 to 3 weeks out from becoming Italy. You know, I was in Italy a little over a month ago when they had one of their first scares, and to see what has happened to that country in, 5 to 6 weeks since then, it's unbelievable. There is no other word to describe it. People kept saying, how could it happen here in Europe? And that's what's fueling this fear here throughout the country. Which country is going to be next? But we also were in Japan recently and other countries in Asia. And when I was in Japan, what I noticed was that so many people were taking this incredibly seriously, already practicing things like social distancing and self-isolation, as well as, sort of a very proper self-hygiene as well. And we've seen some of the cases in places in Asia plateau or even start to decline. Many experts are crediting these services that people are doing. So if there's any major takeaway that we can learn from these other countries, it's now is the time to act. Now is the time to take it seriously before it gets as bad as places like Italy.
On February 7th, I went to the West District of Wuhan Union Hospital. From the 2nd floor to the 15th, this building has been converted into a Level 3 protection quarantine ward for treating seriously ill coronavirus patients. But as I entered one of the wards, I was told that I can't take anything into the quarantine areas, including my cameras.
不行的，我们都没有带东西进去，我们都不能带手机进去。我们里面专门配了一台那个，我们专门自己，我掏钱买了一个台手机，1800块5，我自己买了个新手机放在里面，那个手机是永远都不会拿出来的，除了这个疫情结束了以后，到时候我们把它裱起来，把它留着纪念。
Jing said that whatever goes inside needs to stay inside. The doctors and nurses here have to wear 2 layers of protective suits, hand gloves, shoe covers, face masks, and goggles before entering the special ward.
我的脸都破了。对啊，里面都是水泡，不然的话我这样戴没法戴，太疼了。
Finally, I was led inside with a GoPro, which had to be put into disinfectant for a whole day after filming. The doctors and nurses here have to work 6 hours without rest. They can't drink, eat, or even use the toilet.
林大哥们用了那个纸尿布。
现在穿了吗？
今天没穿。
今天没穿，平时有穿是吗？
有。
那如果说咱们如果想上厕所的话，就只能憋着，是吧？
因为一套防护服300多块钱，我们要这样子调了。
Here I met Dr. Tang Xin, who hasn't been home for 2 weeks.
我是刚给那个一个病人上了一个尿管，然后把那个操作的第3层时候给它抽掉。
Tang said the severely ill patients need special care.
慢慢出现这个氧气不足，那么他的意识就不像刚开始那么清晰，他们会有一些谵妄啊，或者是做一些无意识的活动。这时候你在上呼吸机或者做一些治疗的时候呢，就会有很多困难。但是我们一般都是医生和护士一起协助一起完成。
Since I came into this special ward, the bells of the patients haven't stopped ringing. Nurses have to rush to attend to them all the time. Changing diapers for the patients is part of nurse Zhu Peipei's job.
我们好多护士上完6个小时班出去之后自己吸氧，自己在吸氧。
吸氧的。
The doctors have had to separate themselves in hotels from their families. When talking about her 3-year-old daughter, Zhu Peipei's voice trembles.
要2个礼拜了，2个礼拜，非常紧。晚上下班很晚，中午回去的时候他都睡了，就是我晚上回来宾馆以后想到视频的时候他已经睡了。
After 6 hours of intensive work, Dr. Tang Xin is finally able to take off his protective gear. He has a rash all over his body.
你工作时候一直在忙，就也顾不上，反正就感觉没那么痒。对，洗完了以后，把衣服脱完了以后洗完。
那要多久会消呢？
可能要休息，就是6到8个小时吧。
Medical workers in Wuhan are facing mounting pressure, but Tang believes the future is bright.
我说潘多拉的盒子已经打开了，然后灾难、恐惧、疾病这些都跳出来了。然后，但是这个盒子里面最后的一样东西，就是我们看这个希腊神话里面他说的，就是希望。只要希望还在，那么之前的所有这些都不会是问题。
It's people like this who give hope that one day China can overcome this battle against the virus.
Was the